Hello everyone, this is Dr. Swapnil Chandratre here. So, the last time in part 1 we discussed about the work-life balance and how is the system here, how you can get a lot of holidays and there is how a lot of work-life balance is possible. Now, after the last video, a lot of people have this question that how is it possible? It sounds good, so good to be true that you get to have so many of holidays and still you get to earn so much, and also the clinician also don't run the clinic whole time, then how it is possible to earn so much of money? And don't people feel any competition or any insecurity regarding their patients? Well, the answer to all those questions lies in this video, so don't skip any second of this video because these things will be going to be very interesting. And please share this video to all the people because such information you will not find anywhere, and subscribe to this channel so that I can have motivation to make such videos. And so let's get started. So the first question is that won't dentists feel to lose their patient if they don't run their practice all the time, and if they take so much of holiday, will the other dentist will take away their patient? Now that is the interesting question. To understand this system, we'll have to go back little bit further and compare that system with India. So basically, in early part of 2000s, the Indian Health Ministry had tried to the system with another developed countries, and they showed and they saw that there is a particular dentist population ratio in these countries. That's why their dentistry is very much good compared to India. So basically, according to that survey, there are a lot of shortage of dentists in India. So that's why what government did, that they gave too much permission to so many of the private dental colleges to open their colleges and increase their seats. So because of that, by the end of 2010s and in current scenario, if we see, we have recovered the dentist population ratio now. But we have seen only that ratio. We forgot the most important ratio, that how many people are getting their dental treatments done. So in India, that percentage comes around 8 to 9%, while in Germany this ratio is around 80 to 90%. So it's like around 10 times more people are getting their dental treatment done. So even though dentist population ratio is almost the same in India and Germany, still there are a lot of patients, 10 times more patient to the German dentist. Now, the question arises that how it is possible that so many people are getting their dental treatment done, and we all know that dentistry is costlier in Germany compared to India. Then how it is possible? It's not like that people are so much rich compared to India. Then how it is possible? Well, here comes the insurance system plays a role. Now, when we talk about the insurance system, there also arises the question that in India there is also, not in dental but in medical, there are also insurance system, and still we don't see that good quality of the treatment. And how it is possible? Well, the interesting part of this insurance system is that when you talk about the medical insurance in India, these insurance providers have an amazing scheme that if you don't get any of the medical treatment done in maybe in 3 years or 5 years, every company has their own bonus system, that if you don't use your insurance for a year or a 3 year, then in particular next year you have to pay a less premium. So it's like even though you have an insurance, you are obliged to save your money, and they promote you to not to use your insurance too much. Now that sounds funny, right? But in Germany, the system is totally opposite. Here the insurance system will tell you to get your dental checkup done. So here it's like when you go regularly to your dental checkup, every insurance system will allow you to go to a regular checkup twice in a year. And if you go regularly, so like 3 years, 5 years, so every time you go regularly for your routine dental checkup and get your dental treatments done, then you get the bonus. And when you want to get the costlier treatment like bridges or crowns or something like that, you will get that bonus at the time of those treatment, like 50% or 70%, 60%, all that stuff. So it's totally opposites. That's why people are more motivated to get their dental treatment done and get their dental checkup done. From Here, another important thing is that 90 to 95% of the population is educated, and since their childhood, that from since their nursery, the kids are advised, and they are trained regarding their dental hygiene. They are motivated, and there is also extra training regarding their dental hygiene, so they know the importance of dental hygiene. So since childhood, they are very much aware about the system, and they know that how to take care of your teeth and all that stuff. Here, government is more concerned about the preventive dentistry. In our country, people come more of a time, people come to the dental treatment when there is something happen, like if there is a pain or something like that. But here, people get more of the preventive dental treatment, so it's more like a filling and peat and fish sealant and fluoridation and regular cleaning of the teeth, checkup of the teeth. So it's totally different regarding that thing. There is a trend regarding family dentist concept. So and this insurance system will provide the same money to all the dentists. Of course, dentists can charge extra money over there according to their practice, but still it is not a huge difference. So generally people don't change their dentist unless and until they are unhappy with some treatment, or if they have a bad experience or something like that. So the dentist here don't have this insecurity of losing the patient. And because it's again, all this system is centralized system. So once you are registered under some dentist, it's like a central storage your all the data in that, and if you change your dentist, you have to transfer all that data and all those tedious stuff. So people are also avoiding to change the dentist. So there will be always increase in the number of patient, there won't be a decrease in the number of patient. That's why people don't have such kind of insecurity of losing the patient. Now the second question comes in the mind, that what happens if the situation is started to happen like in India, that in a same complex, we know that now in big cities, in one complex there are 3 to 4 dental clinics. Same thing, what happens if same thing happens in Germany, that all the clinics start to open nearby and there are so many dentists in one area, then there will be a chance of losing the patient, right? Well, to answer that, you have to. There is also an amazing system for that. For example, in India, there are also centralized bodies like DCI and IDA, but they don't get to say regarding the opening and closing of the clinic. Right? They don't tell us where to open the clinic or where not to open the clinic. We can open our clinic anywhere, anytime we want. Here it is not like that. If you want to open your clinic, then you first have to submit all your plans, and have to get registered with the dental council here. You have to show all the quality management and all that stuff. After that, dental council will analyze all your documents and all your data, and then they will see the dentist population ratio in that particular area. And if they find that there are already enough dentists in those area, they will suggest you to open your clinic maybe somewhere near around where there is a lack of dentists there, or they may suggest you the nearby cities that you can open your clinics there. Now if people only want to open their clinic in the same area where they want to live, then dental council will suggest you the dentist who are going to get retired in coming 2 to 5 years, and they will ask you to contact them. So that way you can contact those dentists and take over their clinic. That way patient will not lose their dentist, and you will also get that entire running clinic directly, and those patients also directly. So that way it's like a good partnership with this dentist, and that way they regulate all the dentist population ratio, and that way there are no chance that there will be overflow of dentist in particular area, and there will be a lack of dentist in another area. So that's amazing system, right? Well, after that also a question comes in mind, that what if in future, well, those people who are already in the system, or those who are planning to come here, till the time you are at the level of opening your clinic, you will be on around 5 to 7 years of time. Then the question will arise, that what if all the areas are full with dentists? What if there are no place left for the new dentist to come? What will happen then? Well, to answer that question, you have to see my earlier video. I had made a video regarding the future of dentistry. That was an official statement released by the dental council regarding the future of dentistry in Germany. If you haven't watched that video, the link will come here, and if you have already watched that video, watch that again to have a better idea this time, that what I was meant to say. So this is all about the dental system regarding the dentistry. In future I maybe make a part 3 of this video, in which I will discuss about what kind of dental treatments we are get to do when we are starting the dental practice, what we are allowed, what we are not allowed. I'll see that how is the response of this video goes, and we'll make maybe part 3 of this video in future. And if you have more doubts about the process and how to come here, what is the best classes to choose, what is the best way to come, what is the best way for you to come here, so that you don't get into the complications and your process gets smooth. Well, a lot of the stuffs I cannot, sensitive stuff I cannot speak on the public platform, and also not on email, because you have to understand that I am already in the system, and I don't want to get into the trouble by sharing some sensitive information. But maybe on the Zoom call I will be able to say you on a video call one to one. So if you have more question, you can contact me. The link is in the description box. And please like, share and subscribe, and hit the bell notification, so when I release the new video, you will have the notification. Till then, have a nice day.